Hey there, fellow student pharmacists. Are you just like me who's having a hard time learning about the pharmacologic information of just a single drug type? Well, you played the right video. So stay tuned and grab on your papers and pens as we learn everything we need to know about one of the most widely used antihypertensive, the ACE inhibitors. ACE inhibitor is a very popular class of antihypertensive medication. Today, I will explain everything we need to know about it. But first, let us define what is hypertension. So hypertension is also known as high blood pressure. It is when your blood pressure is higher than the normal blood pressure. Our blood pressure normally rises and falls throughout the day based on the activities that we do. But having blood pressure measures consistently above normal may result in the diagnosis of hypertension. The higher your blood pressure levels are, the more risk for you to have other health problems such as heart disease, heart attack, and stroke. So hypertension is also known as high blood pressure. It is when your blood pressure is higher than the normal blood pressure. So how does ACE inhibitor works to lower blood pressure? So in order to understand the mechanism of action of ACE inhibitors, I have to give a brief overview about the renin-angiotensin-aldosterone system, or the RAA system. So in the event that your body determines that your blood pressure is too low, to meet the demands of your body, the RAA system automatically works to bring your blood pressure up to meet those demands. Just for example, if you are stressed or you are exercising, you need more blood flow and more oxygen to your cells. And in order to achieve this, your blood pressure needs to rise. The way that this is accomplished is through the RAA system. Specifically, it's the kidneys that sense the problem and intervene. Your kidneys will release an enzyme called renin, which keeps the system rolling. Renin first needs to find its target, which is the angiotensinogen, a protein normally secreted by the liver. Angiotensinogen doesn't do much on its own. It's just basically floating around in the blood, waiting to be transformed into something else. Once renin finds angiotensinogen, it then breaks it down into substance called angiotensin 1. Now, angiotensin 1 also doesn't do anything on its own. It's just again basically floating around in the blood, waiting to be transformed into something else. But this time, it requires a different enzyme called ACE for short, or the angiotensin converting enzyme, which is found mainly in the capillaries of the lungs. ACE converts angiotensin 1 into angiotensin 2, which is actually what this whole system is about getting to. This is because angiotensin 2 is what actually helps to raise the blood pressure. And remember, we started with a low blood pressure, and now we see that angiotensin 2 is raising the blood pressure. The main ways that angiotensin 2 raises the blood pressure is by constricting the blood vessels and increasing the amount of sodium and water in the blood. Because the more constricted or narrow the blood vessels are, the higher the blood pressure. And the more sodium and water in the blood, the more water in the blood, because water follows salt, and the more water in the blood, the higher the blood volume, which then results to higher blood pressure. Finally, let's talk about how the ACE inhibitors inhibit the RAA system or helps in lowering blood pressure. Remember that ACE means or refers to angiotensin converting enzyme, which is needed in the area of the RAA system to convert angiotensin 1 into a potent vasoconstrictor, the angiotensin 2. How ACE inhibitors work is actually very simple because it is right there in its name. ACE inhibitors are angiotensin converting enzyme inhibitors. So when you take an ACE inhibitor drug such as captopril, the drug will then bind to or inhibit or block the ACE from working. So if we shut down this part of the system, we cannot convert angiotensin 1 into angiotensin 2. So we get stuck up in angiotensin 1, which is again doesn't do anything on its own. So we don't get any of those blood pressure raising effects. Instead, we end up with a more dilated or open blood vessels with less sodium and water in the blood, which means our blood pressure effectively goes down or has been lowered down. Some examples of ACE inhibitors include the following. Just remember the phrase, Tom eats a large pizza and runs fast in a Benz car. Again, Tom from the Tom and Jerry Show eats a large pizza and runs fast in a Benz car. So T for trandolapril, E for enalapril, L for lisinopril, P for perindopril, R for ramipril, F for fosinapril, B for benzapril, and lastly C for captopril. An easy way to recognize an ACE inhibitor is that to know all of them ends with the word pril. Again, ACE inhibitors are pril-ending medications. Angiotensin-converting enzyme inhibitor, aside from hypertension, is also used in many other health conditions. Just remember the phrase, home care makes patients definitely strong. H for hypertension, C for congestive heart failure, M for myocardial infarction, P for prophylaxis of cardiovascular risk subjects, D for diabetic nephropathy, and S for scleroderma crisis. Now, let us be informed about the important guidelines for taking ACE inhibitor medications. ACE inhibitors should be taken on an empty stomach 1 hour before meals. You should follow the label directions on how often you need to take this medication. The number of doses you take each day, the time allowed between doses, and how long you need to take the medication will depend on the type of ACE inhibitor prescribed as well as your condition. Do not use salt substitutes while taking ACE inhibitors because these substitutes contain potassium, and ACE inhibitors can cause the body to retain potassium. Third, avoid over-the-counter medications, the non-steroidal anti-inflammatory medications, because it may cause the body to retain sodium and water, and somehow it will decrease the effect of an ACE inhibitor. Lastly, never stop taking ACE inhibitors even if you feel it is not working, without discussing it first with your doctor. If you are taking ACE inhibitors for heart failure, your heart failure symptoms may not improve right away. However, long-term use of ACE inhibitors will help manage chronic heart failure and reduces the risk that your condition will become worse. ACE inhibitors rarely causes any side effects, but when they do, it will include the following. Just remember one of the ACE inhibitor drug, which is the captopril. C for cough, A for angioedema, P for pregnancy problems because it can be teratogenic or it can cause fetal deformities, T for taste changes because you may experience metallic taste or others. Others includes rash and fatigue, E for proteinuria, R for renal insufficiency, I for increased potassium or the hyperkalemia, and L for low blood pressure or hypotension. That would be all for today's discussion, and remember our mnemonics. First, medicinal uses of ACE inhibitors. Remember the phrase, home care makes the patients definitely strong. For ACE inhibitor drugs, remember the phrase, Tom eats a large pizza and runs fast in a Benz car. And lastly, for the side effects, remember the ACE inhibitor drug captopril.